pag dumating ka na sa point na hindi ka na matulungan ng traditional dermatologist, na hindi na nag-work yung mga steroids, hindi na nag-work yung kung anumang medicine na binibigay nila o anong treatment, I think it's time for you to really look for other options. Hi, my name is Maridet Bermeo and this is my son Cameron. He's 17 years old. I think some of the factors that led to his condition includes the pandemic as a whole. I think there was some stress factors about not being able to go to school like they normally do, and also being locked up in the house. And I think as well as maybe some food conditions, like some of the things that he was eating was instrumental into leading him to get sick the way he was. Actually, by the time na pumunta kami dito sa DARE, parang sobrang lala na ng condition ni Camryn. Yung tipong hindi na nga siya parang halos makalakad, hindi na siya makatayo, tsaka yung pain ba, sobra na yung sakit ng katawan niya. Before we came to DARE, nag-try din kami sa traditional dermatologist. Yung ina-address nila yung mga symptoms niya, naka-max na kami sa steroids, sa mga gamot, trinay na rin namin mag-UV therapy at lahat, tsaka yung lahat na sinasabi nilang lotions, mga gamot, ginagamit na rin namin. Pero parang, imbis na nakatulong yung mga things na yon, mas lalo lang lumala yung condition niya. So talagang parang hindi ko na alam kung saan ko siya dadalhin, ano ibibigay ko, paano ko siya tutulungan. Kaya when I came to DARE, parang pwede mo nga sabihin parang nasa desperate point na kami. Kasi talagang in pain na si Cameron. Sobra na siyang nahihirap.
Cameron has atopic dermatitis. Atopic dermatitis is a chronic skin condition characterized by redness and scaling on certain parts of the body. So it's a chronic skin condition na paulit-ulit. And it can occur on the same areas, especially dito sa harap ng elbows, sa likod ng knees, sa neck, sa face, And also, the patient is actually experiencing itchiness na very intense, Usually even kahit gabi and umaga, anytime the patient experiences those itchiness.
Halos lahat ng parts ng body niya, pwede mong sabihin na may sugat. Yung para siyang sobrang kate, pero at the same time, parang nagkakaroon na nga ng parang liquid pus na lumalabas dun sa skin niya. Tsaka yung hindi niya na ma-bend yung elbows niya, tsaka yung knees niya, hindi niya na ma-stretch dahil every time i-stretch niya yung mga joints niya, parang masakit, sobrang sakit. Tsaka yung itchy na yung head niya. So, literally, pwede mo sabihin, from head to toe, ano na siya, puro sugat.
Hindi po pwedeng balat lang ang ating iti-treat, We really have to dig deep into the root cause and to really know the triggers, Since paulit-ulit na, we don't want just to treat the skin condition kasi eventually babalik ito kung hindi natin makita yung underlying problems, So, ang una namin ginawa is to relieve him of the itch, of course, kasi it's really bothersome for him. Hindi siya makatulog, hindi siya makatrabaho, hindi siya makaaral, So, yun, we applied conventional dermatology. And also, there was still a need to give, of course, anti-inflammatories in the form of mga corticosteroids, in the form of creams and tablets. And of course, we also gave an antibiotic. And we also moisturized the skin. Because in the case of atopic dermatitis, yung skin barrier talaga is not functioning very well, So may mga leaks sa skin. Yung isa pa natin ginawa is inalam natin yung possible triggers, We did a food intolerance testing to know if there are food triggers, that's causing his skin condition. And also, inalam din natin kung meron siya mga nutritional deficiencies, So, with means of organic acid testing, malalaman natin if there are nutritional deficiencies like B-complex problem, deficiencies in certain B-complexes, zinc, ascorbic acid, if the glutathione levels or antioxidant levels are are low, no? Lalo na ang atopic dermatitis is an immune dysregulation problem. So meaning, walang panlaban yung ating katawan with regards to mga certain allergens or mga toxins or mga microbes, no? So kailangan din yung makita yung mga oxidant levels niya. Unang-una, we have to replace all those nutritional deficiencies, those problems in mga vitamins, no? We replace them with, of course, with mga oral supplementations, and of course we also replace the good bacteria, which is lacking in his case, no? Good bacteria is actually very helpful in boosting the immune system, and also it helps in the digestion of food. In his case, he has bloating too, no? So ang ginawa natin was to put him on high-dose probiotics as well.
Dumating ka na sa point na hindi ka na matulungan ng traditional dermatologist, na hindi na nag-work yung mga steroids, hindi na nag-work yung kung anumang medicine na binibigay nila o anong treatment. I think it's time for you to really look for other options. And I think what really convinced me to come to there is when I was talking to Dr. Jean, she was saying that many dermatologists, ang gusto nilang isolve yung symptom lang, pero hindi nila gustong isolve yung underlying factors, kung ano yung nagko-cause nung symptoms ng bata. So nung sinabi niya, ang kailangan natin i-treat yung kung ano talaga yung nagbibigay sa kanya ng skin irritation, ano talaga nagko-cause ng inflammation, doon ako na-convinced that I have to come to her. The IV drip really helped him kasi parang he always tells me, di ba usually ang bata, ayaw niya napapag-injection, kaya napapa-IV, takot sila sa mga needles. Pero siya, looking forward siya na ma-IV drip. Kasi nga daw, after nung IV drip niya, parang he feels so much better. Na parang, imbis na nasasaktan siya, parang nare-revive siya, umaakyat yung energy level niya, tsaka feeling niya, talagang nakakatulong, gumagaling siya. The other thing na talagang helpful is lahat ng mga supplements na binigay. Kasi lahat yon natural eh. So it really rebuilt his system. Plus yung fact na sinabi ni Dr. Jean, kailangan tayo mag-food intolerance test. Kasi yon doon na-determine kung ano yung mga food na masama sa kanya, kung ano yung hindi nakakabuti sa kanya. And based on that test, ang maganda doon, nabigyan kami ng proper nutrition guide. Kung ano yung mga dapat kainin ni Cameron muna until ma-rebuild yung gut niya, until pwede na siyang kumain normally. And those are the things na I think hindi mo makikita sa traditional dermatologists kasi hindi naman nila ina-address ang diet, hindi nila ina-address yung kung ano yung tama talaga na lotion para sa kanya, kung ano, saan siya hindi magre-react. And that I really appreciate. Kasi parang napaka-holistic ng care. Yung pag sinabi mong holistic, ibig sabihin lahat iniisip nila. Hindi lang yung sugat niya, kundi kung ano yung kakainin niya, ano yung gagawin niya sa everyday life niya. That's why I really liked it.
All this actually is a holistic approach in treating chronic skin condition, no? Unang-una, we have to know the cause, we have to know the triggers, no, which is very important, and the patient has to commit to some lifestyle changes. Of course, we've placed him on elimination diet, no, which is very, very critical. We've eliminated some offending foods that are triggering all these symptoms, no, and of course, no, tinaas din natin yung kanyang mga oxidant-rich foods, which are the vegetables and the fruits in different colors, no. Also, especially kanyang protein, because he's losing water and he's losing protein from the breaks in the skin. No? Kaya mabilis din siyang lamigin, tas ang payat-payat niya. Now, actually, he's gained some weight and he's more active, he's sleeping better, he's actually more relaxed, no, and happier.
Nung first week niya, no, I saw na nababawasan na yung sugat niya. Okay, and that he's able to stretch his joints more. Tapos yung aming pag-change ng bed sheets went from every 2 hours to once a day na lang. Tapos, after the 30 days was over, parang every other, regular laundry na lang. Tapos, yung paglinagay mo sa kanya yung lotion, dati kasi every time, yung umpisa, na nilalagay ko yung lotion niya, parang ang nangyayari is, paglagay ko ng lotion, yung lahat ng skin niya sumasama sa kamay ko. Yung kasing scabs ba? So, parang awang-awa ko doon sa bata kasi parang siyang nababalatan, parang nagsa-sunburn every time. Pero later on, kahit gaano ko kuskusin yung skin niya, walang sumasama. Tapos, smooth na. Kung meron man siya, dry skin lang. Wala nang mga sugat, hindi kagaya ng dati.